Here is a case of inferior calycial stone difficult case with FlexX1 new Carl Storz scope launched today. This is the scope which is very lightweight. No conflicts of interest. I am sharing my experience. See the lower calycial stone here, and it is difficult. Actually, for the first time to use this scope, it was very difficult. But fortunately, could do it. Vision is good. It is 8.5 French to 9 French, very lightweight, and the 75 centimeters length, and the wire connecting on the back side is very small wire, and it's almost like a charger wire and very lightweight. Now you can see the flexion here. It's going almost completely touching easily, and if you see at the junction, it is not flexing. Beyond 1 centimeter, it is junction, it is flexing. I don't know its clinical utility, but I have used today like fan sheath. This is post tented. Definitely this will go through only 10 by 12 French only. That is a disadvantage, but exceptional vision. Natural color matching actually. See here, fan sheath was not there in the pelvis, it was in the ureter. One should be very careful. This is not calyx, this is in the ureter. Excessive pink and excessive yellow is not seen. This is the original color of the FlexX-C. So I am again seeing the same color, which is much appreciated. When I passed the guide wire, it was difficult. Apart from the Carl Storz scope, the difficulty was the kink. See the kink. These are the cases where you should not push blindly. Merge maneuver is done, and after that it immediately went. This was the first difficulty. One should be careful in such cases in the upper ureter. So the sheath has gone into this difficult area. After that I have withdrawn a little bit. A little bit of maneuvers were required to go. Directly I am in the upper calyx. You can appreciate too much color is not there. Now this is the deep inferior calyx. And when I passed the laser fiber in situ in deep inferior calyx, it has gone easily. Actually, it is more sturdy. See, this was a difficult, awkward position. Even though it looks little okay, for me it was looking awkward. But flexibility of the scope was very good. And vision, of course, is expected. It is a FlexX-C quality. It is a FlexX-C1 they labeled. Honestly, lot of scopes have come. So Carl Storz also has launched today. Fortunate to use it officially. They have officially launched, in the sense they are selling it now in India. For this, you need see a little bit of awkward movement easily can be done without much torque on the scope, and 110 Hz, and with vibration the stone could complete it. That's a different issue altogether, but sturdy. Image 1S with X-Link is normal one which we have for laparoscopy, TURP and everything. See how much difficulty I am maneuvering here. Apart from the vision, the case was difficult. The Telecam C3, Telecam, see the external, how much I have rotated with finger, and it could easily reach that abnormal lower calyx. So that means its flexibility and reachability to the lower calyx is very good, deep lower calyx. In fact, I have put the laser fiber a little deep. And the thing is, Image 1S, if you have, it can be directly connected with a connector. And Telecam C3, if you have, this is a basic model of the these things, Carl Storz. They say that it can be connected. And Telepac Plus is a like multi-speciality hospital. If you have for bronchoscopy, flexible and everything, you can use this. Actually, in this case, see the amount of flexion I have done. In this case, actually, if it is in the pelvis, probably I might have shown better view. But anyway, as far as the case is concerned, it was deep inferior calyx, and the laser fiber is coming at a 3 o'clock position. See how deep it is, and all the powder is done at the end. I have not passed the access sheath because I was not comfortable in the going to the flexible scope to inferior calyx. Everything sucked at the end with this thing. You can appreciate the vision. Now, once again, I wanted to demonstrate that the flexible part, if you remove the finger, it does not go back. I will show externally also. You can leave it. See the vision. It's natural colors. And if you if you flex like this, see this much flexion, if you pass the laser fiber, and it is only 10 degrees last, and laser fiber came in easily. Generally this is not advisable, better to keep it straight, but the laser fiber could be passed. That's an additional point I want to mention. The newer scopes keep coming, being Coral Storage a key player. See, even when I flex it and leave, it is in the same position. That's surprising that it's not at all moving a little back. How the string is staying back there, we don't know. Sometimes in basketing it is very useful. So this is a FlexX CA, which is looks like sturdy and high flexibility, and lumen is big. So what I personally feel is lumen is big and highly flexible, and laser fiber could pass it. Vision, of course, like FlexX C Vision, but only thing is size is little bigger. So what they are attaching is simple attachment to the already this is existing Storage Image 1 Image 1 X-Link. This is Image 1 X-Link. If you don't have this, for example, you show my hand with that my hand. This is the clarity. This is my hand clarity. Can you see that? This is the hand clarity. Normally we compare the scopes like this. Can you give one cleaning this thing? Cleaning gauge piece. So record that. So you clean, and then you show the like this. This is the, when you go nearer, this is the clarity. This is the link same used for the Coral Storage. If you have see, the most important point what I am observing here is the flexion is more here, not at the junction. Can you see that? Junction is fixed. See junction is fixed, that's why it is going up to this. If this junction is steady, if it comes for more, actually tip is narrow, but the shaft is little big. Probably this gives rigidity that we have to see. And if you don't have this, Santosh and Kumar, if you don't have this, if the junior want to buy, what they have to be, C-Link or X-Link? What is it?
We have a Telecom C3 camera.
Telecom C3 camera also will give HD quality image. Here this thing is that this camera can be used for the lab, for the TURP, for the URSL, RIRS, PCN, like any other storage camera. So you have to compromise a little bit of 1 to 2 lakhs on that. You can't get all the qualities in one go. That is one thing. If one is Image 1 hub, second is what you said?
Image 1S.
Image 1S.
And Telecom C3.
Telecom C3?
Telepack
X.
Telepack X. What is the Telepack X?
Telepack Plus is our compact camera system, which have monitor, light source, and this.
So you will mix up everything and give, that may go more cost also.
Yes, all-in-one solution. Basically.
All-in-one solution. Yes. All laparoscopy, TURP, everything.
Yeah, everything can be done.
So these are all there in Storage, because imaging modality of the Storage is good. See, to conclude, what we have done is a deep inferior calycial stone, post-stented. We have used fan sheath. It has gone easily in the fan sheath. It is adequate length, 75 centimeter outside, fans 50 centimeters length is available. In fact, sheath we could not push inside because it is inferior calyx. That is the one thing. In the inferior calyx, we could pass the laser fiber, is the most beautiful part today. Vision, of course, is extraordinary. That is the thing. Only in India, how many times it will be used for how many number of cases we will without damage. Can we dip in chemical solution as of now? We can. Even though, see, most of the scopes we are dipping in chemical solution, we have to evaluate that, we don't know. But the beautiful part is this wire is very, very small, almost like a charger wire. This is very light. Scope is also very lightweight. You can measure the scope with our measuring instrument. Very, 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 very light. It's really light. Durability we have to see now. Today is the launch. I wish all the best for the Coral Storage FlexX C1.
Thank you so much.
Thank you. Very good.